came originally because I was in terrible back pain. It was a pain that it would reside a little bit when you went to bed, but you were waking up with pain. You got up in the morning, you were in pain all day long. And it was going down into the back, lower back, and into the butt, and it was starting to affect the legs.
I've been a chiropractor going on 25 years now. What made me decide to put spinal decompression therapy into the practice was I had a patient that had been a regular monthly patient doing well, and he was just coming up to retirement. He bent over and he blew a disc in his low back. And the man was in agony. There was nothing I could do for him because it was so severe. It was, from my perspective, out of the reach of chiropractic. It was such a severe case. That made me start looking at non-surgical spinal decompression, and we've had incredible results. We've been doing it for over 2 years now. We've done many cases, and our success rate is over 80%. The patient first goes through a consultation with me, and we make sure that we can accept their case. Some people, this is not the right therapy for them. Things look good and we accept their case, then we go through a thorough examination. Once the exam is done and we've got a really good diagnosis on what's going on, we tell them that you can come in the next time and we'll start you on spinal decompression and give you a trial run and see what it's like.
But I absolutely have no back pain unless I do something to myself, because I was having trouble. I couldn't even lift my grandkids, and I can now. And I've had lots of people, I've actually had two of my friends say, "We've noticed a difference with you. Like, I know I'm already a little hunched over, right?" And they said, "We see a difference that you actually stand taller and you sit straighter."
We lay them on their back. We strap the pelvis in with the bottom belt, and then the thoracic belt goes around here. And what the table does is it stretches the two belts apart. It's hooked up to a very sophisticated computer. Discs do not respond well to just traction. It's a computer that senses the stretch reflex of the muscles, and it gets underneath that. Muscles are fighting, it lets go. When the body lets go, then it starts to pull. You are strapped right to the table. And then we isolate the pelvic piece so that it picks out the disc that's in trouble, be it in the low back or the neck. We can do the neck also. We dial in a pressure that starts pulling the table apart, but it pulses. Now what this does is it creates a negative pressure inside the disc, which helps pull the disc bulge back in, or it starts pulling things apart so that you can create a positive pressure inside the disc again. Now you create a negative pressure to bring the water, nutrients, and oxygen back into the disc, and then there's a positive pressure inside the disc when we're left, like filling up a tire. And we've brought people back from, I mean, they come in here and walking bent over on canes, and they leave when they're done the process, which is usually about 20 and 25 treatments. They're where they want to be.
The treatments really feel good. I actually do. I was telling Dr. Korsh, I feel taller. I don't know if you really do, but I do. I feel like I'm stretched out, and it feels great. It really feels marvelous.